So we will start the class. So today we will be seeing again the practical parts. That's ADRs, adverse drug reaction, that chapter. Those are having records, they can take your record and we will complete it. Okay, so I think the whole of ADR, it is not taken as per your list. So the first question, a 55-year-old man with type 2 diabetes mellitus, random blood sugar 300 grams per 100 ml, with a history of allergy to sulfonamide, was put on glibenclamide and metformin. After an hour, he was brought to medical OPD with rashes all over the body. Which drug is responsible for this? How will you manage this condition, and what is the alternative for the above? Yes, who can answer that? Safwan Shibli. Safwan. Hello, Safwan.
Yes, ma'am.
Yes. So did you read this scenario?
Yes, ma'am.
It is a type 2 diabetes mellitus on sulfonamide. He is having a history of allergy to sulfonamide already. Now for diabetes mellitus, he is put on glibenclamide and metformin. But after an hour, he developed rashes all over the body. So which drug is responsible for this?
Glibenclamide.
Glibenclamide. Okay. Why you are telling it is glibenclamide, not metformin? Are you able to hear? Because here the power went off. Hello? Can you see? Hello? Hello, can you hear? Yes or no? Please say yes or no. Sania? Yes, okay. Because in between the power has gone. So I think again one more time it will, because it has gone and now it will come back. So, okay, anyway, we will see. So where is Safwan? Why did you say it is glibenclamide? Glibenclamide belongs to which group? Which group of drug? Oral hypoglycemic. Oh, again it's gone. Can you hear now? Hello?
Yes, ma'am. I can hear.
Oh,
yes, I can hear.
Okay. No, because here there is some fluctuations. Okay. Okay, so Safwan, I will tell you, then we will go a little fast today, something, this is in favor for you, okay. So because this glibenclamide, it belongs to sulfonyl urea group, and it has got a structure similar to sulfonamide. So always the sulfonamide people, those who are on sulfonamide, if there is allergy, they can develop allergy to glibenclamide also. So how will you manage this condition? Yes, Safwan, you can answer. How will you manage? So he's developing allergy. So what is the first step you have to do? Yes, Safwan. Hello.
Yes.
Go fast. He is having allergy to glibin glutamate. So what?
So you use metformin?
No. Should we continue glibin glutamate?
No, stop glibin.
That is the first step. What is the alternative? You can continue metformin or you can go for some other drugs. Okay, we will see the answers. See, this is the structure. See, you can see this is the structure of sulfonamide and this is the structure of glibin glutamate. See, somewhat similar. S is there, no? So because of that, they are developing allergy. So you please write down the answers. ABC, which drug is responsible for this? Glibin glutamate. How will you manage? Stop glibin glutamate. What is the alternative? Metformin, acarbose. Any other drug other than glibin glutamate? Over? Go a little fast. We have to finish all the ADRs. Have we finished writing, Safwan?
Yes, ma'am.
Okay. So now we will go to the next the question. The baby born to a 28-year-old lady coming from a remote village area because the baby has cleft palate, hypoplastic phalanges, hair lip, and microcephaly. Her history revealed she was an epileptic on treatment. Sorry. So, Sania, which anti-epileptic drug produced such a picture? So, cleft palate, hypoplastic phalanges, microcephaly, a hair lip. So, Sania, which
Yes, ma'am.
anti-epileptic produced such a picture? Hmm?
Phenytoin.
Phenyl,
Phenytoin.
phenytoin. Yes, it is phenytoin. So, could it be prevented?
Yes, ma'am.
Yes. So we can go for some other drugs. So it is actually the fetal hydantoin syndrome, or it's caused by phenytoin. So you can write down the answers. Which anti-epileptic? Phenytoin taken during pregnancy produced tetragenicity, that is fetal hydantoin syndrome. Could it be prevented? We can give carbamazepine or phenobarbital, which are relatively safe in pregnancy. And also we have to give folic acid. This you know, we have to give folic acid along with iron to avoid any ADRs like neural tube defects caused by different anti-epileptic drugs, especially valproic acid only. But anyway, better give folic acid for all anti-epileptic drugs. Okay, please write down. Sania, is it over? Have you written? Hello.
Yes,
Have
ma'am.
you finished writing?
Yes, ma'am.
Yes. So we are going to the next one. So this is a 50-year-old male on haloperidol on antipsychotic for the last 4 weeks was brought to casualty with complaints of restlessness, apparent agitation, uh, manifested as a compelling desire to move about but without anxiety. So he was on haloperidol, it is an antipsychotic, and he is developing a condition, restlessness, apparent agitation, and compelling desire to move about. So without anxiety. He is moving up and down, so apparent agitation. So what is this presentation? IFUNA. Can you tell me what is this presentation, IFUNA?
Yes, ma'am.
Any idea what is this presentation?
Akathisia.
Oh, very good. It's akathisia only. So how will you treat it?
Reduce the dose of haloperidol.
Okay. So name two other drugs that can be used for treating this condition.
Benzohexol.
Yes. What is benzexol? What is benzexol? What is a drug? IFUNA.
Anticholinergics.
Yes, it is a centrally acting anticholinergic. Very good, very good. You answered all the question. So you can write down the answer. So you have already referred it, or you are telling from your memory. You are telling, or you are already referred. IFUNA.
Yes, ma'am.
Yeah. Okay, whatever it may be, it was good. Okay, you can write
Yes,
down.
ma'am.
You can write down the answer. No problem. It was good. What is this presentation? It was akathisia. How will you treat it? Reduce the dose of haloperidol or change to atypical antipsychotic like risperidone or quetiapine. Name two other drugs that can be used. It is diazepam or centrally acting anticholinergic drugs like triacylphendyl or benztropine or etc. Benzexol. Write down. Hope all of you are writing in your notebook. Don't take any screenshot. That is a waste of time, energy, everything. So better you write it on a book. Okay, shall we move to the next one? IFUNA, have you finished writing?
Yes, ma'am.
Okay, we are going to the next. So whenever it is over, inform me because we have to finish now. Okay, now next question is a 46-year-old female with category 1 tuberculosis was put on ATT. ATT means anti-tuberculosis treatment Next day, she came to casualty crying, saying that she is passing orange red urine. And he's thinking that her kidney is totally damaged. Okay, I will ask Ahida Hasna. Ahida. Ahida Hasna? Ahida.
Yes, ma'am.
Yes. So here the lady tuberculosis patient is here. Don't disturb the class. Don't disturb the class. Yes, Ahida.
Yes, ma'am.
So the, no, please. Abi bulare.
So,
Please close. Okay, Ahida, you can mute your phone. Ask someone
yes,
else.
ma'am.
You mute
Yes,
it.
ma'am.
You mute. Please mute your phone. Okay. I will be asking some other person. Abu Bakr. Abu Bakr.
Yes, ma'am.
Yes. So this is a female. She's tuberculosis patient on ATT, anti-tuberculosis treatment, and she's having a complaint that is she's passing orange red. So which drug produced this? Yes, Abu Bakr.
Isoniazid.
Isoniazid. Isoniazid will produce orange red urine. Which drug? Yes. Amrita. Amrita, can you tell which drug? Tomorrow you have to.
Rifampicin.
Yes, tomorrow you have to appear for the quiz competition. So you should be thorough with all these things. Okay. So it is rifampicin. Okay, then what was the mistake with? Okay, I will tell. Mistake with the doctor is that the doctor did not communicate this information. That is, after taking rifampicin, because ATT will be containing rifampicin, and there will be urine will become orange red. So we have to inform to all our patients who are on rifampicin that there will be such an adverse reaction. So that is the mistake of the doctor. Which drug? It is rifampicin. Other major serious side effects like hepatotoxicity or hepatitis, then flu-like syndrome, and other abdominal pain, etc. can occur. So you can write it down. Doctor did not communicate properly about the possible discoloration of urine, and the drug is rifampicin. And major serious side effect, hepatitis, flu-like syndrome. Is it over, Amrita? Have you finished writing?
Yes, ma'am.
Yes. Okay, so we are going to the next one. A 56-year-old type 2 diabetes mellitus with hypertension on enalapril consulted his family doctor complaining of irritating brassy cough. So whom should I ask? What is the brassy cough due to? Fatima Hiba. Yes. What is the reason for this brassy cough? Fatima Hiba? Hello. Yes. What is the reason?
Yes,
For, or which drug caused this brassy cough?
Angiotensin converting enzyme inhibitor.
Which is the angiotensin converting enzyme inhibitor here? She's on
Enalapril.
enalapril. Okay. What is the reason? Can you tell me the reason for this brassy cough?
Bradykinin.
Yes, it's because of the bradykinin. Okay, because this ACE inhibitors, it also the no who has who is disturbing the class? Please, is it Fatima house? If so, you please mute your phone. Please mute your phone. Please don't disturb the class. Yes. So we will write the answer. So what can be the reason? Inhibition of enzyme by enalapril reduces the degradation of bradykinin. So the levels of bradykinin is increased, which causes only cough. Other two adverse, many adverse effects are there. I have written two adverse effects, angioedema and teratogenicity. What further step to be taken to help the patient? That is because he is on enalapril, so he is developing cough. So we have to change the antihypertensive. We can change to ARB or any other drug, calcium channel blocker or any other drug we can change. Okay, please write down the answers. So whenever you come for the class, either you should be in a room which is closed, or please tell your family members to leave the room when you are attending classes. Okay. So because you cannot concentrate and although the class will be disturbed, so please find a place where your family members are not coming, or ask them to leave your room. Somehow you have to make arrangement. Is it over? Hello.
Yes, ma'am.
Yes. Okay, we are going to the next one. So 60-year-old male with congestive cardiac failure was put on digoxin or digoxin 0.125 milligram. He was taking this tablet daily for the last 4 weeks. So daily he was taking 0.125 milligram for the last 4 weeks. He was brought to casualty with vomiting and abdominal pain. What could be the reason for this? So this is a patient on digoxin. He's taking daily for last 4 weeks. Yes, Nasla. What is the reason? What is happening here?
Digoxin toxicity.
Yes. How could you prevent this? He has to take anyway digoxin because he's having congestive cardiac failure. How can you prevent this adverse effect? Nasla. Any idea? No. Nila, yes, tell me.
Ma'am,
Nila, how can you?
we can stop digoxin.
We cannot stop digoxin because he is having congestive cardiac failure. So immediately we can stop, that is okay. But What is the further step? How can he prevent this? Anyway, he has to be put on digoxin. What is the step? See, digoxin, it is having
Digoxin antibodies.
that is only for digoxin toxicity. It's very high toxicity. Okay, I'll tell you. Because digoxin, it always produces cumulative toxicity. So usually we have to give only 5 days a week. Here the patient was taking daily, 7 days. So that is the only alternative. So we have to, what could be the reason? Vomiting and abdominal pain are symptoms of digoxin toxicity. Digoxin stimulates CTS and chemoreceptor triazone and causes vomiting. How would we prevent this? Prevented by taking the digoxin tablet 5 days a week so that the cumulative toxicity does not occur. So please write down. So always digoxin, it is 5 days a week. It is not 7 days because it has got cumulative toxicity. Okay, have you finished writing? Yes or no? Not finished?
Yes, ma'am.
Yes. So I think all of you have finished writing. Then we will go to the next one. Yes. Ram, a 40-year-old factory worker, that is in a nitrate factory, develops headache on Mondays, which disappears on weekends. So what is the reason for this? Yes, I'll ask Joseph. Joseph. Joseph.
Yes, madam. Yes,
Yeah.
madam.
So what is the reason? So there is a factory worker, nitrate factory. He is working in a nitrate factory, and on Monday when he joins, he is developing headache. But weekends, that is by Saturday, he is having a holiday, no? So he will go home, and after this headache disappears towards the weekend. So what is the reason for this?
Tolerance to the nitrate.
Yes, tolerance to the nitrate. Suppose there is an angina patient on transdermal nitrate. How will you prevent the above side effect?
Nitrous oxide.
No. What I'm telling, see, same condition can occur. Transdermal nitrate, if you are giving a patient, angina patient, daily if you are giving, after some time, there won't be much response. There will be development of tolerance. So how can you prevent the tolerance?
It given in an interval of 4 to
Yes.
6 hours.
Yes.
Free intervals.
Yes. So daytime you can give the TD, and night you can go for some other drug. Okay. So you can write this.
Yes, madam.
Explanation is here. You can write tolerance. You just write tolerance to night. Okay. You can write down. Same thing we have discussed. I'll give you 3 minutes. Finish writing. Oops. So, second, the fluctuations. Are you all there? Hello. Nila BK, are you there? Oh, shit. Just go on.
Yes, madam.
Okay. Because in between here today, the power, there is much fluctuation.
Yes, ma'am.
Okay. Thank you. I thought that everything got disconnected. Have you finished? Nasla, have you finished writing? Nasla is not there. Nasla. You have left the class?
Yes, ma'am.
Oh, still problem. Oh, please.
Yes, ma'am. Finished.
Your phone. Many.
Yes, ma'am.
Is it over?
Ma'am, finished.
Have you finished writing?
Yes.
Okay.
No, ma'am.
No. Okay.
Finished.
Go first. See, Nasla, in your house, please find a place where others won't disturb your class. Okay. So in this, people are shouting.
Yes, ma'am.
Yes, ma'am.
Oh, yeah. Finish writing.
Yes.
Yes.
No. I am talking to Nasla. So Nasla, can you hear me? Hello, Nasla, can you hear me? Where are you, these people? Nasla,
Yes.
can you hear me? Nasla.
Yes, ma'am.
Yes.
Yes.
I am just telling you.
Yes, ma'am.
I don't know. Why different days are coming?
Ma'am, I can hear.
You can.
Yes, ma'am.
Yes. This is Nasla only, no? Who is telling yes?
Oh.
Okay, then no problem. Parveen, have you finished writing?
Nasla.
Okay. Finished writing, Parveen? Parveen.
Yes, ma'am.
Okay. Then
Ma'am?
yes. Is it over? Have you finished writing? That's what I'm asking.
Yes, ma'am.
Yes.
Yes.
Okay. Now we are going to the next one. A 45-year-old diabetic, that is coronary artery heart disease. The CHD means coronary artery heart disease. On isosorbate dinitrate takes sildenafil citrate in the night for ED. ED means erectile dysfunction, without consulting his doctor. So he's a cardiac patient. He's on nitrate and he also takes sildenafil citrate without consulting his doctor. That is, he's having erectile dysfunction because of that. Next morning, he has severe giddiness and was rushed to casualty. So what is the reason? What is the reason? Yes, can anyone tell? Because people, yes, 1 minute. Yes, Shamima, go first. It's time is flying. Shamima, you are not there, Shamima. Can I make you absent? Shamima. Yes, you are absent. Ashwini, are you there? Ashwini. You're also not there, Ashwini? Yes. Okay. Gilan, Mariam? Gilan.
Yes.
Gilan. Oh, no. What
Yes,
is
ma'am.
in all of your houses, people are disturbing your classes? You cannot, you should not attend the classes like this. You should not sit in inside among a crowd and attend the class. That is not fair. Okay. You have to understand something. No, please find some places where you are sitting alone. Ask your family members to go out of your room. Then only, because
Yes, ma'am.
yes, please mute your phone. I don't want to listen from you. It was much disturbances. Gilan, you can mute your phone. Okay, I will say, so because sildenafil citrate, this isosorbate nitrate, it causes vasodilatation. Sildenafil citrate also, it is a PDE5 inhibitor, phosphodiesterase 5 inhibitor. It also causes vasodilatation. So there is a synergistic effect, so double effect. So this may cause hypotension and he may develop this giddiness, and sometimes he may develop myocardial infarction also. So precautions to be taken. So there should be always, there is a gap between if the patient is having this coronary artery heart disease and erectile dysfunction together. Always there is a gap between nitrate and sildenafil. On nights when he is taking sildenafil citrate, there should be a gap of 8 to 12 hours. So you can write down the answer. Sildenafil causes vasodilatation of vessels. This is useful for erectile dysfunction. Nitrates also cause vasodilatation. Together, they may cause hypotension. Precaution: nitrate should be stopped for 48 hours before using sildenafil. Okay, please write down. Go a little fast. I have to do something. So we'll go to the next one. I think this is the 1 minute. I'll just see whether yes, that is the last one. So this question, a teenager with severe acne vulgaris, you know what is acne vulgaris, was prescribed capsule tetracycline antibiotic for 3 weeks. After 1 week, she came to the dermatologist with complaints of nausea, vomiting, and frothy urine. When the capsule strip was examined, it was outdated. So the expiry date, it is over. Urine microscopy showed proteinuria, glycosuria, and amino acid urea. So what is the syndrome? Can anyone tell? Outdated tetracycline causes what syndrome? Any idea? Yes, Fanconi syndrome. So the products that cause this syndrome, I don't know whether they will be knowing it. Which tetracycline is safe in patients with renal insufficiency? Anyone can tell.
Doxycycline.
Who is telling that? Who is telling
Shifa.
Shifa. Yes, very good. It is doxycycline. Okay, you can write down. Fanconi syndrome, that is a syndrome. Outdated tetracycline. The products that cause this syndrome are epitetracycline, anhydrotetracycline, and epi and hydrotetracycline. And doxycycline is the one that is safe in renal insufficiency.